Welcome back. While we're dealing with COVID, our dogs are dealing with canine flu that's very contagious.
Yes, so what do owners need to know about this and other issues affecting our pets? Joining us, Dr. Trustin Moore. He's a veterinarian in West LA and Torrance. Good morning, doctor. Thanks for joining us. First, just start off by telling us, what is canine influenza? What is it?
Yeah, thank you for having me. Canine influenza is a highly contagious virus, similar to influenza virus that we see in humans. However, it is contagious from dog to dog, and there's no evidence of transmission from dog to human. Some similar signs that we do see associated with this are respiratory disease signs, so coughing, sneezing, ocular and nasal discharge. Highly contagious. We're seeing it break out in common areas such as dog parks like this, boarding facilities all across LA. And in very severe cases, we actually can see a secondary bacterial infection causing pneumonia in these kids, and it can become quite deadly.
And doctor, how do you treat it? Do you just, let the time pass, or do you need to take your pet to the veterinarian?
Yeah, right now with this outbreak, I would say if your dog if they're showing any of those signs that we just mentioned, I would recommend having them evaluated by your veterinarian or an emergency vet, because right now we are treating these guys with various medications because it is highly contagious.
And doctor, that's not the only issue we want to talk to you about today. LA County animal shelters are near capacity once again, and there's an urgent plea for people to adopt. If you can adopt, what are the other ways people can help?
Yeah, absolutely. Adoption is so great, but I encourage families to think about, make sure you are ready to adopt as a family. But if you can't adopt, considering fostering a pet is a perfect way to provide temporary housing for these guys, as well as just giving donations. So asking, about food donations or providing bedding, clothing, etc. So definitely reach out to your local shelter.
Dr. Moore, thank you so much for joining us early this morning. We hope you have a great rest of your weekend. We appreciate you.
Thank you, doctor.
Thank you. You as well.